I'm talking about dapagliflozin, a sodium glucose cotransporter 2 inhibitor. Cotransporter 2 or SGLT2 inhibitors are typically indicated for treatment of type 2 diabetes mellitus. They help control blood sugar levels by increasing excretion of glucose in the urine. They're also used as an adjunct treatment in people with heart failure and chronic kidney disease through an additional mechanism of action. Is available in tablet form at a typical dosage of 10 milligrams daily. It's taken orally with a good bioavailability of 78%. It's absorbed in the small intestine. Takes 2 hours to reach a peak plasma concentration of 44 nanograms per milliliter up to a concentration of 62 nanograms per milliliter when taken on an empty stomach. However, there's no clinical difference between whether it's taken with food or with fasting. Drug is metabolized in the liver and kidneys through glucuronidation via reaction with glucuronic acid, broken down into the metabolite dapagliflozin 3-O-glucuronide. This metabolite and any residual medication is then excreted mostly into the urine, filtrate, and partially into the bile, and is ultimately eliminated from the body through urine and feces. The glomerulus in the kidneys, glucose is filtered from the blood into the urine filtrate. In the proximal convoluted tubule, on the proximal end, SGLT2 is a protein transporter in the cells lining the tubule wall. It is responsible for taking up glucose and sodium from the urine filtrate and returning it to the bloodstream. As a competitive inhibitor of SGLT2, binds to the active site and prevents the passage of glucose and sodium into the epithelial cells. The end result is that the glucose and sodium continues down the tubule inside the filtrate. It's ultimately excreted into the bladder and then urinated and exits the body. There is an additional protein transporter, SGLT1, in the distal end of the proximal convoluted tubule. However, this is only about as 10th of effective as SGLT2. So even though it is not inhibited by dapagliflozin, 60% of the glucose that is filtered is still excreted from the body. Believed to be additional mechanisms of action that make it effective in reducing risk of adverse cardiovascular events and at slowing the progression of kidney disease. These mechanisms are not really well known. Associated with usage of dapagliflozin include those due to the increased urination and the amount of glucose in the urine, such as an increased risk of genital and urinary tract infection or development of a necrotizing fasciitis of the perineum. Because of the reduction in glucose, it's also associated with hypoglycemia and diabetic ketoacidosis and can cause a transient drop in renal function. Indicated in anyone with an allergy to the drug, anyone with severe renal disease or a prior episode of diabetic ketoacidosis. It's also worth noting that as renal function declines, the medication becomes less effective in controlling blood sugars because less glucose is being filtered from the blood, and so less of it can ultimately be excreted when SGLT2 is inhibited. The associated risk of hypoglycemia is worse when it's used with insulin or sulfonylureas. There is an initial drop in kidney function with commencing the medication, although this does come back up without intervention. People are at increased risk of falls when taking the medication because of its diuretic effect, leading to hypovolemia and associated orthostatic hypotension. The medication should also be ceased when anyone is fasting or before surgery. It's also not recommended in anyone with severe liver disease. There's a Schedule 4 drug requiring prescription from a medical professional and is listed on the pharmaceutical benefit scheme. It should be made aware of the risks of genital infections, then that they should pay extra attention to their toileting hygiene, They should see a doctor as soon as possible if experiencing any symptoms of a UTI or bladder infection. They should present to the emergency department or call 000 if experiencing any abdominal pain or severe fatigue, which may be indicative of diabetic ketoacidosis, or if they're experiencing any symptoms that may be due to a necrotizing fasciitis of the peritoneum, any pain or infection in the peritoneum. They should also drink plenty of water to mitigate any risk of dehydration. There's an increased risk of infection when taking dapagliflozin. It's B, the genitourinary system. Patients for blood sugar control will have the highest risk of hyperglycemia when used with dapagliflozin. It's D, insulin and sulfonylureas. Presentation. Thank you for your time.